Following 13 slides, we will cover schizophrenia, dementia, eating disorders, ADHD, OCD and PTSD. In Learning Outcome 8, we cover understanding schizophrenia, looking at the causes and the media representation of the condition and how it can be managed. You'll be asked to look at media reports about the people who have schizophrenia and describe how rare but high-profile cases are sometimes presented in a negative way, this causing misunderstanding and fear about the condition. You should be aware that there are a combination of factors that contribute to schizophrenia. You will be asked to describe a minimum of 3 possible causes, such as genetic, biological, and substance misuse. Asked to describe a variety of feelings on individuals with schizophrenia and how they may experience it at different times. We should also look at the impact of schizophrenia on different aspects of an individual's life, including relationships, discrimination, employment, prospects, and changes in their personality. Also exploring how the changes in the individual and concerns for their well-being may cause distress, tension for family friends, and the impact of this on their lives. For this slide, you should look at a range of interventions. They're suggesting pharmaceutical and non-pharmaceutical that are used to treat individuals that have schizophrenia. And then looking at a range of self-help strategies individuals could use to help manage the illness, such as taking care of their physical health, reducing stress levels, sleep hygiene, exercise, and accessing supported networks. You should look at the importance of support from family and friends, including practical support with daily living activities when this is appropriate. Encouraging individuals to consider how education can help family and friends to understand the early warning signs and responses appropriately when the individual is experiences specific symptoms. You'll need to explore treatments and resources just as you have done in the other mental health conditions in the previous units, such as individuals with schizophrenia finding resources in their own locality, including support which may be accessible again through the community mental health team, NHS, mental health organisations and support groups. Learning Outcome 9 is understanding dementia. In this unit you will gain an understanding and how it can affect the individual and others, family, friends and work colleagues, and ways it can be managed. You'll be asked to provide a definition of dementia as an umbrella term, together with 4 of the most common types of dementia. There's a lot going on under that umbrella. All kinds of different illnesses, conditions that are termed dementia. You should provide a description of how dementia affects different functions of the brain, such as memory, decision making, communication, language, and recognizing faces and objects. You should also look at the psychological changes that occur in the brain with the most common types of dementia. There may also link in factors that contribute to the risk of an individual developing dementia. For dementia, you'll be also asked to write about the signs and the symptoms and how they influence an individual's experience of dementia. You probably know somebody that has got dementia, either in your family, friends, whether they are in the early stages or in the latter. All scenarios and experiences will be useful for you when you're writing the answers for this unit. You'll need to explain the impact of the effects of dementia on an individual's daily life, looking at their independence, their self-care, relationships, safety, security, and obviously nutrition. The impact of an individual living with dementia on their family and friends, both emotionally and in the practical terms. You'll then be asked to look and describe a range of pharmaceutical interventions that may be used and examples of therapeutic strategies and approaches that are effective in supporting individuals with dementia. You should be aware of how families and friends can provide support through person-centred care, life history, work, social contact, and help with daily living activities. I have known where people, for their individual that's got dementia, they've made memory boxes, filling it with photos, little treasures from years ago, to give a talking point and just to jog the memory of that person with dementia. You'll need to look at the specialist resources and treatments which are available to individuals during the different stages of dementia which are in their local area. You usually see dementia cafes about where they do activities both for the individual, but also it's a respite for the carer that's looking after that individual. And consider how actions or words by those who lack of understanding of dementia may unintentionally cause distress or compound difficulties for the individual and the carer that's looking after that individual with dementia. Learning outcome 10 is understanding eating disorders. Again, you will gain an understanding of eating disorders and the causes, how they can affect the individual and others, family, friends, and work colleagues, and how eating disorders can be managed. You'll be asked to provide a definition of eating disorders again within the clinical context. You should describe at least 3 of the 4 main types of eating disorder, such as anorexia nervosa, bulimia nervosa, binge eating disorder, and other specific feeding or eating disorder. They may also include orthorexia and avoidant restrictive food intake disorder. You should all be aware that the causes of eating disorders are complex, so you will be required to focus on one specific eating disorder and describe at least 3 potential factors which may contribute to an individual developing an eating disorder. These may be genetic, psychological, environmental, social, or biological. And of course, you may know somebody who unfortunately has got an eating disorder. This then allows you to use this, if you would like, in the scenarios for your answers. In this slide, you should provide examples of signs and symptoms of each of the main types of eating disorders, demonstrating an awareness of the difficulties that may arise in recognising the signs, as it is a common feature, unfortunately, for individuals to conceal them. You should then be encouraged to think about the effects of an eating disorder in the short term and potential implications for the individual's future life, considering physical and psychological effects and how these may affect the individual's behaviour. In this slide, it asks you to demonstrate awareness of the impact on family, friends, and the difficulties that may arise in recognising the signs and this behaviour. Because, as we've said before, it's common for individuals to conceal them. In that way, they don't receive the help that they so greatly need. You'll be asked to look at the local resources and treatments available to people experiencing an eating disorder. This should include an explanation of what other people close to the individual can do to support recovery, focusing on one specific eating disorder only for this unit. Learning outcome 11 is understanding ADHD, attention deficit hyperactivity disorder. Again, you'll gain an understanding of this condition, the causes, and the effect it can have on the individual and others, again, which will be their family, friends, and work colleagues, and ways it can be managed. You'll be asked to provide a definition of the term ADHD within the context of this qualification, looking at a lifelong developmental condition which affects behaviour and may coexist with mental health problems. You'll then look at the prevalence in terms of age and gender to identify those most likely to be diagnosed. You should be aware that although ADHD is most likely to be diagnosed in childhood between the ages of 6 and 12, it can be diagnosed in adults too. We all should be aware that although the causes of ADHD are not fully understood, there are a number of possible risk factors. For example, genetic links and prematurity. You'll be asked to describe the main characteristics of ADHD and the potential effects on an individual's development, behaviour and daily lives. Looking at how this affects the family, the parents, and obviously others within the family context. How the individual lives or works, both positively and negatively. Hopefully you will be able to give examples of a range of common symptoms of ADHD and how they may vary between children and adults.
1749.
You should also research local resources, treatments available to children and adults who have ADHD, looking at descriptions of ways others close to the individual, such as their parents, teachers, family members and friends, can support them to manage the condition. Learning outcome 12 is understanding obsessive compulsive disorder, otherwise known as OCD. Here again you will gain an understanding of the condition and its causes and how it affects the individual and others and how it can be managed. You'll be asked to write a definition of OCD, again within the clinical context. Describing a range of potential factors which may contribute to an individual developing obsessive compulsive disorder, such as biological, genetic and significant life events, personality, and an overlap or coexistence with autism. In the unit, you'll be asked to describe 3 main elements of obsessive compulsive disorder and the feelings an individual may experience. Again, you may know somebody that has got the illness, and so you can use true life scenarios for many of your answers. You'll be asked to describe how unwanted and intrusive thoughts can affect their behaviour and the impact their daily lives, as well as how the condition can affect family and friends. You'll be asked to provide examples of common obsessions and associated behaviours that individuals may present with. You should describe a range of ways in which an individual can promote their physical and mental health, share feelings with family, friends, support networks, and find time to relax through activities that can promote more positive thought processes. Looking again, as with other units and other mental health conditions, for local resources and treatments which are available to people in their own area, but particularly for these with OCD. The final learning outcome is 13, which is understanding post-traumatic stress disorder, PTSD. Again, you will be asked to write about the causes and how it affects the individual and others, and how it can be managed, just the same as you have throughout the award with the other units. You'll be asked to write a definition of PTSD, again within the clinical context. Again, you may know somebody who unfortunately suffers from PTSD, and so when it asks you to write about the type of traumatic events which could contribute to an individual developing PTSD, you may know firsthand. If not, you will be able to research this. It also says that you should be aware that PTSD may occur immediately after an event or after a delay of months or even years. It goes on to ask you to describe the range of feelings a person with PTSD may experience and how the anxiety can disrupt both their daily lives and those of their family and those close to them. You'll be asked to describe a range of ways in which an individual can promote their physical and mental health, share their feelings with family, peers, friends, and support networks, and then find time to relax through activities which promote more positive thought processes. You'll be able to, as you have done in previous units, look at local resources and treatments which is available in their own area for people with PTSD.